What's been one of your biggest challenges after weight loss surgery that you didn't expect?
For me, it's been the mental. It's been the accepting the body that I have now, if that makes sense.
Oh,
Even though,
doing this for a long time.
yeah,
It actually takes people years for their head to catch up with their body. Yeah.
yeah. So like I said, October 1 was my surgery day. I am down over 120 pounds. I still go to the plus size clothes section.
Yeah. Normal.
I was,
It's crazy. Yeah.
Yeah, I was looking for a coat recently, a raincoat for my trip, and I was trying on extra larges and double XLs, and my husband grabbed a small and made me put it on, and it fit. And to me, that was like, even though I had it on, I couldn't accept it.
Yeah.
I was like,
Yeah.
no, there's no way. And I compromised and got a medium. Because I wanted room, darn it. But my brain is just really struggling to be accepting of where I'm at and where I'm still moving towards. But in my mind, I still go to that plus size section first for clothing, and I still, gravitate towards that. There's still clothes in my closet that I haven't gotten rid of because I'm like, well, but I might need them, and slowly I'm getting rid of them because I don't want to need them.
Yeah.
But yeah, my mind still keeps telling me I'm not what I am now.
It's, having seen, help thousands of patients now, like that is a very common story. It's really hard for your brain to catch up with, decades of history. And all of
Mhm.
a sudden in like 10 months, you're just like, you're shopping on a normal rack now. And
Yeah.
like it's interesting. It's really interesting. It's cool, but it's hard.
Mhm.
That's a really hard place for almost everybody to be like, to accept kind of the different where they're at now. Because all the time, right? You get something, you're like, there's just no way this is gonna fit, and it's loose, and you're
Mhm.
like, it just always gives you like this really weird reality slap in the face mentally, because you're like, man, I am so far off in my head about where I actually am. Like what? I don't know what to make of this. So
Yeah.
And I would say I have that similar feeling as Callie does, but I'm still early on, so I'm kind of just adjusting to that. I still have
yeah,
the visual thing, but more for me, it has been the planning and prep in my day.
Mhm.
Um, for food per se, and it's not like, oh, I have to prep everything, but being successful is about eating a good breakfast, having a good snack, having a smaller snack, having lunch, and doing these things in that, every 2.5 to 3.5 hours, and I was so accustomed to, hey, I wouldn't eat, I wouldn't say do the fasting, but you get busy, you won't eat till noon, and it was okay because you would catch up and you would overeat and in my brain, and it was fine, you got full, no big deal. Where now is like, if I eat breakfast, then I'm, usually about 7, 8 o'clock, and then it's like, okay, well, 10:30, even though I'm not hungry yet, I need to have a small snack. I need to, and it's not like, well, you kind of get to that habit. Well, I'm not hungry. Why should I eat? And it's like, oh, well, because if I wait to eat till I'm hungry, I don't feel good. And I don't mean like uncomfortable. I just feel nauseous. And then you eat, and it just gets back into that old cycle. So if I'm away, when I'm at home, it's a little easier. Once I have to go in, if one of the days I have to go into the office, or I'm traveling, or if I'm just out on the weekend with my family, I'm still working on how to plan for that. Either bring snacks with me, have those kind of things, or if I'm staying somewhere. I mean, it's a lot of that for me has been the most difficult aspect. It's not unachievable, but it's changing your mindset and making sure you have a little bit more to be prepared with going out. and it's not hard, but hey, like you get meat sticks from Costco to have to take
Mhm.
with you. You have some hummus and stuff, to take with you. Have some vegetables. You need to make sure you have snacks with you. And as a guy that never had snacks because I knew I could buy something like chips and stuff out, that's probably the hardest thing to out in not at home is the hardest thing to find is things to snack on. It's harder to go to a convenience store and just buy
Mhm.
something because it's
Yeah.
chips and things and snacks and sweets that I don't want to say one you shouldn't be eating just health wise, but those are the hardest things to digest. So you don't want to eat those anyways. Even if you're going off the rails, it's just uncomfortable. So I think that's been my biggest challenge is the prep and learning and getting that new way.
Yeah. Thanks for sharing that. And that's I think you guys, both of you have done a great job of being very intentional about
Mhm.
rebuilding your relationship with food,
Mm.
which is so central to this journey. And, and honestly, really inspiring, just hearing how like, hey, I know I foresee this and I have a plan. I gotta bet that's gotta feel really good when you're like, hey, like look at how far you've
Yep.
come. Like, and look at and also I think you know, as someone with a family, like it's a great example for your kids, you know,
Mhm.
when you're like, because I think that is something that we've never really had before is to have our parents have very intentional relationships with food to show us and be good models, examples for us as how we're supposed to eat when we're adults. Because when you're eating as a kid, like you're generally burning a lot more calories. Like you got a lot more wiggle room there. But like as an adult, like we need to see our parents like, hey, have very intentional relationships with food because in the 21st century, our lives are they're getting more easy, they're getting more comfortable, and calories are getting easier to get. So
Mhm.
it's never going to get easier to manage our weight. It's just not.
Yep.
So, you guys brought up some awesome points, and the intentionality with your relationship is with food is really so pivotal to this journey.